Hello, hello, it's Dr. Pam here. Come into the room. This is the last Wellness Wednesday of the decade. Come on, join me in the room now. Let me see, I need to send one more, let me see if I can send one more thing out to remind everybody. Let's see. Let me just do that. Let's see. I'll wait for you guys to get on. Come on, come on, come on, come on. Hello, somebody has joined me. Okay, I'll be right there. I'm just trying to send a reminder to my group. Okay. All right. Let me go on and introduce myself. I am Dr. Pam Middleton, your virtual holistic physician. Through my books, programs, and services, I help families achieve and maintain health and wellness through inside out healing. So today is the last Wellness Wednesday of this decade because next Wednesday is Christmas Day, so I won't be doing a Wellness Wednesday then. I'll be taking that day off to be with family. And so the following Wednesday, it will be the new year. So I decided to come on tonight and do a live Q&A. So if you have any questions, go on and drop them into the box. There's a little delay, so I may not see them as soon as you put them in there, but go on and put your questions in. And just to give a disclaimer, I cannot give medical advice, but I can give you general health and wellness information. So if you have some general questions, like general health and wellness questions for either you or your child, please do put that in the box, and I will be happy to answer those questions. And while I'm waiting to see if anybody's going to come on and ask any questions, I do want to just share. I've been basically talking about the same thing over the last 2 to 3 weeks because it is cold and flu season, and there is I'm seeing a lot of influenza B. I'm seeing a lot of it. I mean, literally every day I've diagnosed at least 3 to 4 children with influenza B. So it is out there. In the community. Luckily, if you can say luckily, it's not, the children don't seem that sick. And I've seen some adults with it too. Parents have had it. And so people are getting it. There are a lot of people are getting it, but they don't seem to be, extremely sick. But of course, remember the way the flu works is that for most people, it's a self-limiting disease and, you recover from it. It's like having a really, really bad cold. But there's always going to be a percentage of people who do not do well with it. And, I am always telling you about, what to do to boost your immune system. Want to make sure that you're getting plenty of rest, eating well, trying not to be stressed. And I mean, this is the season, 'tis the season to not get rest and be stressed. I understand that because I myself was sick a week or two ago. So I totally understand that. But, also you want to, understand, like, if you do have a cold or your child has a cold, that there's no miracle cure. You can go to the doctor to make sure that nothing serious is going on. But if your doctor tells you your child just has a viral infection, then that's actually a good thing. And, don't get mad, storm out of the doctor's office because, your doctor didn't give you antibiotics or a Z-Pack. Because now people come in knowing what they want. Like, well, can I just get a Z-Pack? No, you can't. And so you definitely want to make sure that you have all of that information. And if you missed some of my previous talks about that, you can go to my YouTube page. Or actually, you can just go to my Holistic Huddle page, and I will be having more information there. Okay, in fact, I'm probably going to go live there over the weekend. So this is my last Wellness Wednesday. This is the last Wellness Wednesday, but this is not my last live for this decade. My last live for this decade is going to be over in the Holistic Huddle, which is my Facebook group. And, if you join the Holistic Huddle, remember you can join that and you can still go there to ask questions. Once again, hi, I see somebody's joined me. Hey. Once again, remember, I can't give you medical advice, but I can give you general health and wellness tips. I can answer general health and wellness questions. So, any information that you get from me is not to be used in place of medical advice from your doctor. You should always reach out to your doctor. Okay, so I see a couple of people have joined me. Do you guys have any questions about anything? Any questions? Nobody has any questions? Do y'all want me to talk about something in particular tonight? Come on, if y'all don't, I'm gonna go and eat because I'm hungry, because I just got in. It's been a long day for me and I haven't eaten my dinner and I'm hungry. I'm just being real. I'm just being honest. Okay. All right. So y'all aren't going to ask any questions. So, I'm going to talk about one more thing before I leave. It's about 8 after, so I'll stay on until about 10 after to give people a chance to get on. But I did say that I was going to make an announcement. So my announcement is that I am going to be expanding my brand in the new year. So I'm going to be adding something new. But guess what? You got to stay tuned for the new year to hear what it is. Hey, Pastor Darrell, any general info on asthma for teens? Okay, yes. Asthma in teens are for anybody, especially during this time of the year. Asthma can be triggered by colds or upper respiratory infections. So asthma is an allergic disease. So most people, I only see the one about any general information on asthma for teens. Did you have another question before that? It comes up slow, so well, no, that's the first thing I've seen because I just saw the one that says you don't see my questions. So I do see the ones for asthma. So yeah, so asthma is it's an allergic, it's a disease that's based on allergies. It has an allergic component. So most people who have asthma also have some type of allergies. And so most of the people who are asthmatics are on something like cetirizine or Zyrtec, especially during any seasons like that they may get seasonal allergies like seasonal allergic rhinitis, because once again that can trigger their asthma attacks. And so now that it's cold and flu season, people who have asthma will tend to be triggered. If they get a cold, they can be triggered into having an asthma attack. And then oh, you're going to say more in a minute. Okay. And then when you talk about risk factors for the flu, because remember I was saying most people do well with the flu. So asthmatics are one group that tend not to do well with the flu. Like someone who has asthma has a much higher risk of ending up in the hospital or in ICU after having the flu. Okay. So if you have asthma, your child has asthma, and they have asthma medication, make sure that you're following your asthma action plan. Your doctor should have given you an asthma action plan, and that usually consists of all the medicine that should be taken and when it should be taken. And one of the things that I know parents get this confused a lot. With asthma, you have different types of medications. You generally have like a short-acting bronchodilator. That's something like albuterol. So most people have heard about albuterol. And so that is to be used when you're having like wheezing or an asthma attack. But also you usually have a long-acting steroid. And so, or a low dose, not long-acting steroid, a low dose steroid. That's usually something that you're supposed to give every day, but a lot of times parents get it mixed up and they'll come in saying that they've been giving like the steroid when needed, like whenever their child wheezes, and they've been giving albuterol every day. That's not right. You know, because that's how we can tell how controlled your asthma is. You shouldn't need to be taking your albuterol inhaler every day or even a few times a week. So that determines if you are controlled or not controlled, and more medications or different medications can be added to control. And the other thing I will say about asthma is that I think asthma has become very common, but asthma is very, very dangerous and does kill people. And we're seeing more people dying of asthma because I don't think people take it as seriously as it is. So even though you or your child may have an inhaler, it doesn't mean that it's always going to work, because there are people who will decide that they won't go into the doctor or the emergency room because they can just use their inhaler at home like every hour. If you're needing to use an inhaler every hour, that is not good. You need to get in somewhere, because the next step is that you really can't breathe and you would need to be intubated. And if you're nowhere near a hospital, you're not gonna make it. And I recently heard about somebody who recently died of asthma, a fairly young person. So asthma is a very serious disease, and you don't want to take it lightly. You want to have it under control as much as possible. Okay. Oh, hey, Dr. Michelle. You're welcome. Okay, Pastor Darrell. So you said you were going to have more questions for me in a minute. Do you have any more questions for me? Any more questions? So we talked about asthma. Anything else you guys want to hear about? Because I've talked about the flu a little bit. Nothing else? Let me see. Is it, oh, it's 8:15. Okay. Going once, going twice. So remember, I'm going to be expanding my brand, and you're going to hear about what I'm going to be adding next year. Do I recommend any holistic or naturopathic intervention? What about preventive actions? Yes. So the big thing is to avoid the asthma triggers. There are homeopathic remedies that can help with asthma, but because of the severity of asthma, I always recommend that you have your regular asthma meds, but you would really need to work with somebody who specializes in homeopathy, who can really come up with a particular plan for you or your child, and they can tell you, like, okay, because traditionally what would happen is somebody may say, okay, here is a homeopathic medicine, take this, and then if it doesn't work in like a minute or two, then go on and use your inhaler. Okay, but the big preventive actions, like I said, is to avoid whatever the triggers are. So everybody who has asthma should know what their triggers are. So you want to avoid those triggers. And if you can't avoid the triggers, and you start to, like, let's say cold is a trigger, and you can't always avoid getting a cold, so you get a cold, you want to be very aware. So if you're having any problems with breathing difficulty, take your medicine. If your medicine is not working, like I said, you have your asthma action plan, and it tells you when to call the doctor, when to go to the ER, when to call 911. So follow that asthma action plan. If you do not have an asthma action plan, or your child does not have an asthma action plan, go to your doctor and get one. Don't wait until your child is sick. You want to have an asthma action plan, because that's what's going to save you or your child's life. Okay, Pastor Darrell asked about the flu shot. So you want to know how effective the flu shot is this year, because you heard me saying that there are a lot of cases of influenza B. So the thing to remember about the flu shot is that the flu shot is not like 90% effective. Okay, it varies from year to year. And what the flu shot will do, a lot of times those who have the flu shot may still get the flu, but it can decrease the severity of the flu if you do get it. So the flu shot is not going to necessarily prevent the flu, but it will decrease the severity if you do get it. And the flu shot does not cause you to get the flu. As with anything, some people can have side effects, from a flu shot, but traditionally there's not a lot. Most people do fine. Okay, wait a minute. Let me see what else you're saying. Let me see if I missed anything. Okay, I didn't miss anything. Yeah, you have to take a wait a minute on this, Pastor Darrell. Okay, let's see. Leah says, your child has elevated thyroid antibodies. How often should you check that? She's 7. Okay, so that's something, Leah. I was saying that I can't give you medical advice in particular for your child. So that is specific. That's a very specific question. So I suggest that you talk to your child's doctor to figure out a plan as to how often you should be checking her thyroid antibodies, because that's probably going to have something to do with whatever her clinical course is, which I don't know that. So you definitely want to follow up with your child's doctor and come up with a plan for how often you want to check that and what else you can do about that. Okay, and then let's see. Pastor Darrell says, would you touch on alcohol use during the holidays? Oh, yes, I will definitely talk on alcohol use. Okay, so yes, everybody wants a reason to do things. Like the holidays are a reason for us to do unhealthy things sometimes, like eat too much and maybe drink too much. So, alcohol use during the holidays or at any time. First of all, you want to be responsible. So if you are driving, do not drink and drive. And, remember that your alcohol, like how it affects you with driving, it's going to depend on the way your body metabolizes things, first of all, and also your body weight and what you've eaten. So, if you go to a cocktail party and you hadn't had anything to eat all day and you show up and have like a couple of drinks before you even really eat anything, that's not your alcohol level is going to be pretty high, and you're probably not going to want to drive a car right away. However, if you go to dinner and you sit down and you eat a whole meal and you have like one glass of wine with your dinner that you are drinking very slowly, depending on how your body metabolizes things, you may or may not be okay. I would say always err on the side of, if you're going to drink, have a designated driver. Nowadays, there's always somebody who doesn't drink. Or you can just designate over the holidays. Okay, look, it's your turn to be the designated driver. I'm going to drink tonight, vice versa. Next time, I'll be the designated driver. You could drink. That's always going to be the best thing to do. And then one more question. Do I know if there's any information on teens texting? I don't know about any information out there, but what I can say is it's not just teens, okay? A lot of people are texting, are distracted, not just texting, anything, distracted driving is a problem. Obviously, texting is a big issue, but now with the smartphones, somebody may actually be trying to reply to an email, or, people do all kinds of things in the car. So, try to be present and not distracted, because there's nothing worse than causing, serious bodily injury to yourself or someone else over something, as trivial as, well, I just looked down, to see that text. If you have a newer car, a lot of times in the newer cars, there's a do not disturb. It'll actually say that while you're driving, people who send you a text will get a message saying that you're driving and you can't respond to them right now, and you will respond to them, when you stop. I've been in rental cars where you have the option of, displaying the text. But once again, that can lead to distracted driving depending on, what you're doing. So, well, not displaying, I guess you can listen to the text, I guess you say. So it will play the text for you. Uh-oh, my light just went out. Oh, no. Okay, but y'all can still see me, right? I'm not that dark. But, oh, here it is. My light's back on now. Okay, I'm back. My little light went off. So, yeah. But, so I don't know. So, to answer your question, Daryl, is that I'm sure there is information, but I can't tell you exactly where to get it. There's definitely distracted driving with teens, but there's distracted driving with everybody, okay? But the problem with teens is that they are generally very inexperienced drivers at that. So, an inexperienced, distracted driver is just a double whammy, okay? So that's something else that you should, you should talk to your teens about it. And in fact, that reminds me of something, Daryl. Because I said it can happen to anybody. I was at an event. It was a health event, and they actually, let me see what you said. Hungry. Okay, wait a minute. I'll get to the hunger one in a minute. I was at a health event, and they did this thing where they had a bunch of people to pretend you're in a car. And I think, was I the driver? I think I was the driver. And so it was like me and maybe 3 other women, so we're like supposed to be in the car, and, we're just talking. We're just having a general conversation. And I actually was more distracted than I realized, because then somebody like all of a sudden was in front of the car, and I did not see them approaching. I didn't see them walking to the front of the car. And, it was very startling to realize how distracted I could be just riding in the car, talking to people in the car with me. So, and most of us now, I know I'm guilty of it. Usually when I'm in the car, I'm on the phone. So yeah, you have to be really careful about the distracted driving. And so Pastor Darrell said, since I said something about being hungry, how important is waiting before hunger when you... Well, you know what? What you can do with hunger, you actually should eat at certain times. Like, we all get up, we eat breakfast, I eat 3 meals a day. So I eat breakfast, lunch, and dinner. And my meals are generally kind of planned. Like, when I get up, I eat breakfast before I go to work. And if I'm running late, I may eat breakfast on the way, or I may eat breakfast when I get there. But it's good to have set times. A lot of times, if you wait until you're hungry, you may actually overeat. So you should eat every certain amount of hours so that your blood sugar doesn't drop too low. So, don't wait too long. Like, don't eat breakfast at 8 and then, skip lunch and now you're going to eat dinner. You're going to be starving, because what tends to happen when you're really hungry, you tend to make poor food choices, because we've all been there. You missed lunch because it was really busy, and so now you're just gonna run to the machine and get something, or now you're on the way home, and all of those places that you shouldn't stop to eat, they all look good or they all smell good. So then you end up stopping somewhere that maybe you wouldn't normally stop, because you are just, as I like to say, starving like Marvin. Okay, so I think it's important to have regularly scheduled meals and try to eat within a certain time frame. And stuff happens, but really, try not to go too long in between meals. And your body and how long you can go, because for some people will actually have problems with their blood sugars dropping really low if they go too long in between meals. Okay, so I think that is it for the questions, and I will put something up about my first Wellness Wednesday of the new year, where I will be making my announcement about how I'm expanding my brand and what I will be offering in the new year. Okay, so you guys enjoy the rest of this Wellness Wednesday. Enjoy the rest of this decade. And remember, 2020 can be a new year. It's a new decade. It's, there's all kinds of positive things that you can look forward to in the new year. But finish up this year strong. Don't just let everything go. Okay, what'd you say? Okay, you said one last thing before, Pastor Darrell. I'm hungry. No, I'm just kidding. Okay, hey, Michelle. One last thing. Would you touch on complementary and alternative medicines, the things that general med has failed to acknowledge or help with MD support? Okay, yes. And that's something that I'm really, really big on. Anybody who may know my dad's story, my dad was a very good example of using complementary and alternative medicine along with traditional medicine, because he was extremely sick, almost died, was in the ICU, but we also used biomagnetism to help save his life. We use biomagnetism, we use prayer, and we use traditional medicine. And so my thought is that it's always best to integrate everything. You want to do the best of both worlds. You don't want to get stuck on saying, well, I'm only going to do the natural stuff, or I'm only going to do this traditional stuff. You want to find a physician. I, of course, because I'm a medical doctor who does integrative medicine, I'm a little bit biased about this, but if you find a medical doctor who knows something about alternative medicine also, that's great, because they can help you with everything. If you need if you need a prescription drug, they can do that, but they can also help you with the alternative treatments. However, if you can't find that, you can always work there. You know, there are other people like naturopathic physicians. A lot of them will work along with your doctor. So if you find somebody outside of your regular doctor, you want to make sure that you're letting your doctor know everything that you're doing. You know, we are way beyond the time now where you should be afraid to tell your doctor that you're doing something natural, because it's always been the way I've always looked at it is if you cannot be honest with your doctor, then you need to find a new doctor. Okay, so if whatever you're doing, your doctor needs to know everything you're doing. So if you can't find an integrative doctor who practices integrative medicine, then you find yourself an alternative practitioner who can work along with your doctor, and then that way you get the best of both worlds. Okay, and Pastor Darrell said amen. I say amen, and I can go eat now. Okay, so I just want to thank you guys for joining me. I want to thank you guys for listening to me, throughout the past, all the Wellness Wednesdays I've done in this decade. I'll just say in this decade. If you want to see some of the, some of the Wellness Wednesdays that you may have missed, they are all on my YouTube. Well, they're not all, but a lot of them are on my YouTube page. I'm trying to add more and more to the YouTube page. So what I'm going to do is after, I finish this broadcast and after I eat, I will come back and I will put a link to my YouTube channel. So please do go and subscribe. I don't have many subscribers, so I'm just going to go on and beg y'all, please go and subscribe to my YouTube channel. Thank you. So what I'm doing now is that the things that I'm doing on Facebook, I'm actually, putting on my YouTube channel also, so that you can go there and find things. And I was on the channel the other day and I saw my jars video. So for those of you who missed that, I did an experiment called The Jars Revealed, where I took a Happy Meal from McDonald's and I put it in a mason jar, and then I put as my control, I put a banana and some apple slices from the Happy Meal in another mason jar, and I kept on looking at what everything looked like over time. So if you go to those videos, you will see, I think it starts on, some things are actually missing now. I'm still looking for everything, but you will probably find the first one. Then I think it jumps to month 1. I don't think, I was doing them every month, but I think some of the months are missing. But try to find the original, and then I know there's month 1, and then maybe month 3, month 5, so it goes up. I've done it, I did it for over a year. And I still have my jars. In fact, I'm going to have to do another Jars Revealed and see what it's looking like now. Yeah, I'm going to have to do that. So, okay. So Darrell said, wait on the Lord. Okay. All right. So, yes. So thank you guys for all of your support. And I look forward to serving you more in the new decade next year. So I am Dr. Pam Middleton, your virtual holistic physician. Through my books, programs, and services, I help families achieve and maintain health and wellness through inside-out healing. Bye-bye.